This device is quite different than splints or retainers that are delivered in dental offices. First of all, in this discussion, it must be understood that the temporomandibular joint is a general joint of the body. It is, as I said earlier, no different than any other joint within the body, and just like a knee reconstruction or an elbow reconstruction or a hip reconstruction is a medical device reconstruction, this is a medical device. It is not a dental device. Although it does go in the mouth, it has nothing to do with anything that's in the mouth. It doesn't change the teeth, it doesn't change the bite, it doesn't change anything. The only thing it does is it rests the jaw joint. It's a device that rests the jaw joint and allows the inflammation to go down and allows all the symptoms to recede. A dental device, better known as a splint or sometimes a splint retainer, the most common kind is a device that goes over the surface of the teeth. I've seen hundreds of those brought into my office, and they just give you something else to chew on. And the patient will chew on those, and they'll chew on those through their back teeth, and they will overload the joint, and the pain will continue on. So that's the primary difference between the average dental device that, and splint that we see and others. So this device was developed independently by myself, and I certainly used an awful lot of information from other individuals, though, coming up with the solution of why there's a common denominator, how the common denominator works, and why it is so successful. As I inferred before, rather than going through and reading more journals, looking at more lectures, reading more books on the temporomandibular joint, and doing what most of the profession says you should do about it, that's called deductive reasoning. I just listened to a patient, or several of them. They told me what to do. I tried it out. It worked. And then I had to figure out how it worked. That was inductive reasoning. But it certainly is successful, and I certainly want all the patients in the world who have long-standing temporomandibular joint problems to consider its use.